IPF really hasn't got any treatment options, or many. Once diagnosed, a patient usually has 2 to 5 years to live. There are 2 drugs that will help slow down the progression of the disease in mild to moderate cases. And they are not funded here in British Columbia. They are funded everywhere else in Canada, but BC patients do not have that access.
Idiopathic pulmonary fibrosis is a disease of the lungs, fairly rare at this point because it's difficult to diagnose. So when you go to your doctor, it isn't that the doctor is ignoring you, it isn't that your family doctor doesn't care about you, it's that that family doctor has not seen this disease.
I went for a hip replacement operation and got out of hospital, and a few days later discovered I had IPF, and with a fairly short prognosis of 3 to 6 months, but that was a couple of years ago, and I'm kind of hammering along reasonably well.
It was unfortunately one of those situations where they didn't know what he had.
It's a complicated disease. They're just beginning to really understand bits of it now.
There is no cure for IPF. The alternative to this is lung transplant. But don't forget that transplant is not the answer for everybody, because this is a disease that affects people over the age of 65. And they are not going to be accepted for a transplant simply because of their age. If we can provide them with a drug that has the promise of slowing down the disease, of helping them with their disease, that is huge. We have people that have been on the medication for 2 to 3 years, and they are leading active lives compared to what would have happened if they hadn't had the drug.
When I first saw Dr. Marson, he explained that this was the only drug they had that could maybe help, but he said that the side effects would not be easy for me at all. I think it's helping me. Well, it seems to be slowing down the fibrosis. I can't measure that, but I think my breathing is slightly better. Maybe it's the exercise, maybe it's the drug, I don't know, but I'm sure it all helps.
These drugs are the only thing that you have to help with sustaining life at this time. Physical activity is also proven to be really important. There's many things people can do for quality of life. I mean, there's everything you can try to do to help improve your circumstances, but those medications are life-sustaining. They are fundamental, they're funded by every other province, and I don't think there's any excuse. My dad has had an incredibly productive life. He's contributed to the BC and the Canadian economy in a substantial way, and he deserves that drug. This needs to change quickly.
I'm still enjoying life, and I wouldn't mind keeping it going for another couple of years, so I think the pill would help me.
In order for us to engage these treatments, we need to have these drugs funded by the BC government. We don't have any other recourse because there are no other drugs. They will save lives. They slow down the progression of the disease. And if they're not funded, people will die.